Hello, everybody. We are here like other times for our webinars. Today, we are going to do a webinar of the Sweat C25, our portable device, our new portable device. Then we're going to explain to you a little bit the characteristics of this device and all the things, the important things about how this device goes, how this device makes the physiology, the treatments, and all the important things about psychotherapy. Okay, then first thing I want to say to you is that you know that yesterday we have the same webinar in Spanish. Then the international clients that want to see the webinar in Spanish can register on this webinar, and then they can see the recovery of the webinar of yesterday. Okay, and then also I want to tell you the next webinar we will have on Monday. We will have a webinar of fractures treatment. Okay, then if you want to see it, it's in Spanish, and then in January we will have it in English. Okay, then we will do the webinars in both languages because we want you to arrive and to understand what we do, everybody. Then the first thing I have not said, but for those ones that don't know who I am, I'm Esther, one of the physiotherapists team, and I want to say to you that we are going to do this webinar with another college, with Carina. Carina is another one of the physiotherapists of Capenergy's team, and well, we are staying together here, and we are going to explain you a little bit how this device goes, how this C25 goes. Then, for the webinars, for the ones that don't normally stay in our webinars, I want you to tell one thing. The best thing we can do is to answer the questions all at the end, okay? Then if you have a paper, you write the questions you have, and then at the end we will be here together, Carina and me, and we will ask you. We will ask you all the questions you have. Okay? It's because if not, we are going to see the chat and we will stop the presentation, and it will be very noisy to do that. Okay? Then we're going to start. First, we are going to do a more commercial part of what we have, what the C25 is. After, we will explain a little bit about the indications, the physiology, okay, and all the papers we have, okay, the different important things we have. Then you will see that our presentation will show you how what is C25. Okay, it's the portable device we have, and then you will see all that. Okay, we will have these contents in the index, and we will explain you a little bit all this. Now we'll stay with you, Carina, and then she will continue explaining you more about this device.
Hi, everyone. Well, my name is Carina. I'm a physiotherapist, and we work together with Ester here in Capenergy. And today I will explain the C25, the new features that we can see in this new portable device. And also I will talk a little bit about the indications that this device have, and then Esther will explain you a little bit about the physiology and what the bibliography says about it, And then at the end of the presentations, we will be together answering your questions. And also, I would like to say that the next webinar that we do on Monday is about fractures, and we will also be together. So if you want to join, you only have to register. Okay, so let's start. So here it is, the C25. Okay, it looks like this. And as you can see, if you know the rest of the cap energy devices, it's smaller than the others. And it works in a different way because it's different, the technology of a portable device. But you will see that it works very similar. Okay, we can obtain very similar results. Now let's see the features that makes it special and perfect to do treatments on the go, as we say. Okay. First of all, we are in front of a first generation device. Yes. What does it mean? It means that this device has only you can perform only capacitive and resistive manual treatments, but not automatic ones. Okay. It has only one channel of working, and then the second generation devices, they have other specifications. You have normally more than one channel. You can also perform automatic treatments. So the main difference between the C25 and the rest of the first generation devices is that it's portable, okay? And now we will see a little bit the difference and the characteristics. Okay, we have that it's a class 2A medical device. It's certified by the notified body CE1639. And the manufacturer is in Sant Joan d'Espí, a town of Barcelona here in Spain. Okay. And well, let's talk about now about the highlighted features of the C25. Okay. The first thing is that it's portable, as we said before. So it works perfect for the therapists who do home treatments, or they have different jobs and they have to transport it from one place to another. It's very easy and very comfortable to transport. Like thanks to its lightness, it's very light, very small. And we also have a special backpack to transport it, so it's very easy. Okay. Next, we have that although it's small, it's very small, it has 200 watts of power, which certifies it as a high-end equipment. What does it mean? It means that we can perform treatments it's a very correct power to perform all type of physiotherapy treatments. The title of this webinar is the most powerful portable device with the CE certification on the market. And it's because it's true. It's very small, it's portable, but you have a very good power to the treatments. Next, we have the touch screen. You can use it. It's different from the others because here you have in the screen you see all the buttons, all the options that you can use it, and then in the other slide we will put a video so you can see how you can work in the touch screen. Okay. Yeah, this device comes with a flexible passive plate. It's different from the others that they are not so flexible. Here, it allows you to adapt the plate to the shape of the body, or you can also use it as you see in the photo. And for example, it allows you the patient do exercise while you are doing the treatment. And now let's put a video when you will see what I'm saying. Okay. Let's see. Okay. Okay, so let's continue. Let's put again the presentation. Okay, now the preset protocols. To finish, yes, these preset protocols will help us to make a specific treatment. This is also a difference because in the other devices we don't have this option. But now let's see another video where you will see how you can work in these different protocols. Okay, let's see the other video. Yeah. We switch on the device. It is the menu. And we go to protocols. And now here we can choose a lot of different protocols for very specific injuries. And here then you can start the treatment, okay? It shows you if you have to use first the capacitive, then switch to the resistive, the time of the treatment, okay? Very good. Let's continue with the slides. Okay, another important fact that we have, not only in C25, but in all our devices, is that they have a security control that allows the patient to stop the treatment at the moment that he or she wants. And also, we always clean and disinfect all the plates and all the accessories after every treatment. So this gives us confidence that we are working in a safe way for all, for the therapists and for the patients, okay? Very important. Now, the indications that we have, and we can use it, the C25, are physiotherapy and rehabilitation. You can use it in sports medicine, very useful, in pre and post-surgery, in phlebology, dermatology, aesthetics medicine, urogynecology, very useful also. You have the option to have a probe that is a resistive probe to perform this type of treatments, okay? So you have a lot of options. What's more, the certifications. Capenergy as a brand, they have a lot of injuries, a lot of pathologies that we certified that the treatments work with this technology. So here you have the list of all this, okay? As you can see in this list, we have a wide range of acute and chronic diseases that we can treat. So the C25 is a great tool for the physiotherapists because it's a good complement, a perfect complement to our treatment, our manual treatments. Okay. The objectives, the goals that we can have, for example, are very different. For example, reduce inflammation, improve microcirculation, reduce the pain, very useful, improve muscle trophies, improve the immune system. In this later we'll explain a little bit, Esther. regulate the sympathetic nervous system, reduce fear fibrosis, improve, last of all, the quality of life of the patient. And who can be treated with the TCAR-C25? All the patients, okay? Adults and also children. There is any contraindication to treat the children. You only have to take into account the temperature, but in general, you can treat all the patients. Obviously, if following the contraindications, but if not, for all the patients. And which professional can benefit from a C25? Any professional that wants to have it in their clinic, or also if you do home treatment, is a perfect device, as I said before, because you can transport it from one place to another very easily. Okay, so now Esther will explain us a little bit of the physiology. So she will start this.
Well, yes, we continue with the physiology, okay? And the physiology in TCAR therapy, okay? Then you will see, if you see another webinar so fast, you will see that the physiology is the same, okay? Because it's a TCAR therapy, then we know how TCAR therapy used to go and how this TCAR therapy makes an influence in the system, in the metabolic system. Then you know a little bit of this, but I will explain for all these people that don't know how TCAR therapy makes this metabolic system, okay? This action in this part of the system. We have to know that we have devices that works in different levels, okay? We have all our devices, C25 included, can work in 3 different modalities. Can work in isothermal. It means that we work with less than 50% of the power we have. And also we can work in hyperthermia. Then we can work in 2 ways to work in hyperthermia, moderately thermal or frankly thermal. It depends if you put less power or more power, okay? If you put the total of power, it's a frankly thermal. And if you work with 70% of power, you are working in moderately thermal, okay? Then with the C25, you can work in the same way, okay? And it will be an important thing, because if we work in isothermia or in hyperthermia, we are working in 2 ways different of action in the body. 2 ways that are studied and that have bibliography, but I will make a little summary of what they do in the body. The important thing of the isothermia is that it's working inside the cell, okay? This is very important, and in the last years, it will be the important thing about TCAR therapy, okay? The important thing of metabolic effect. But we know, because the amount of studies that we have do it during the last years are from hyperthermia. And when we are working in hyperthermia, we have effects internal and external of the cell, okay? It's because we have the thermal shock proteins that are making effects. We will explain now, okay? But I want you to know that we have these 2 ways of action, and both are important. And with the C25, we are working in both ways to action, okay? We are going to see first the isothermia. Okay, when we are working in isothermia, we say we are working with 50% of the power. We are working inside the cell in the mitochondrial effect. But what happens when the current goes in the cell? Okay, we have here a cell, and we have all the membrane, and then when we put the current, the electromagnetic current, to go in, what the effect we have, it's that we have a change of the ions between the outside of the cell and inside of the cell. Okay, then how we have this change of ions between the outside and inside? It is because we, with the electromagnetic fields, we can open the channels of the cell, of the membrane, and then the ions can make a difference. The important ion in the radio frequency is the calcium ion. Okay, here you see a calcium channel, and then when we switch on and we start the treatment, what we can have is a change of this calcium ion. Then when this calcium goes into the cell, it goes, it makes that different effects can be do it. And the important effect is in the mitochondrial effect, okay? It's because we can make a good effect of the mitochondrial. When we have the calcium, we make a generation of the free radicals and the cytokines. And this is a very important thing, because when the calcium goes in the mitochondria, we make that improve the nitric oxide and the reactive oxygen species. The reactive oxygen species are very important, because if you have too many of free radicals, then it is bad for the body, it's harmful, then it's not a good thing. But we need a few of these reactive oxygen species to make a regulation and to protect the organism. Then, the normal thing is that you have this reactive oxygen species. But if you have too much, it's when it's harmful. It's like when we have inflammation. Okay, the normal thing in the body is that we have inflammation to recover the tissues, then to go there more. Well, we will explain this after, but yeah, to make the recovery of all we have. And if you have too much inflammation, it's a harmful thing. Okay, with the reactive oxygen species, it's the same. Then here it's the reason that, because the TECA therapy is an intermediary in the mitochondrial metabolism. But we have another important thing in the internal effect in the cell with isothermia. It's the macrophage. The macrophage is the cell that do the phagocytosis. And when we have a stimulation of the macrophage, we produce more oxygen and we have more pro-inflammatory cytokines also, and then other factors of inflammation. Okay, then we see that we have all this intermediary of inflammatory process during this metabolism of the cell. Then it's very important, because we are doing a mitochondrial effect and an inflammatory effect, that it's good to make a recovery faster of what we have there. And we say that we have another way of action. It's the hyperthermia. The hyperthermia is when we have effect inside the cell and outside the cell. We have the same effect of inside the cell that we explained before. And also we have effects outside the cell. Why? Because when we have a stimulation of radio frequency, we stimulate the fibroblast, we stimulate the neocollagenesis, and then we produce more tissue, okay? when we are working in hyperthermia, we make an effect in thermal shock proteins, and this effect is to protect the cell and to increase the immunity system in the good way. Then we need to do this. Another important thing of the radio frequency is that we know that we are stimulating the prostaglandins E synthase. Then, when we stimulate these prostaglandins E2, we have a good vasoconstriction, increase the muscle relaxation, inhibites the relief of the mast cells mediator, inhibits the excess of inflammatory cells. Okay, then we know that we have many things, many important things that are good to the metabolism when we use radio frequency. All this physiology that I explained has a bibliography, okay? And if you want more about the bibliography, you can ask us and we will give to you all we have. But when we are talking about C25 and we are talking about all the therapy part in musculoskeletal part, we have many studies that, well, I put here 3, but we have more studies that we can show to you to know very well what says the bibliography about all this. Okay, we have papers and all that. Today we have different papers about different issues. Okay, then you can ask, because maybe you work more in urogyn or you work more in other areas, in vascular area, or then we show to you specifically about your interesting things you have, then you can ask to us. And now we're going to talk about how we do a treatment with the C25 of Cap Energy. Okay, everybody knows that normally when we treat, we do first an evaluation, and we do some supplementary tests, and then we have a diagnosis. Well, we have normally the physiotherapists, we have a medical diagnosis, and then we arrive to our evaluation. Then this is an important thing. But now we're going to see how we do a treatment only with a C25, okay? Without anything more. We will see a video. No, I have it here. A ver. Play video. Now, I put it on. Yeah, we are. Of only the car therapy, only with the C25, and in this video you see a treatment of a capacitive treatment. Okay, you have both electrodes, capacitive and resistive, and then here we show you how to do, in this case, the capacitive. Okay, but it's important that you know that normally we don't do only the therapy treatment. We do more treatments in a same session, and we can combine these other techniques with the therapy, with mobilization, with exercise, active, resistives, eccentrics, with proprioceptive work, all that, okay? Then now we will show you a treatment, do it with both things, okay? With the therapy and with another technique. Yes, with exercise, I think, okay? Then we are going to see it. Thing we want to explain to you is that we want you to know that you are not alone, okay? When we talk about Capernaum, we talk about several professionals that are with you, and when you normally when you have our device, you are registered on my clinic in Medicina del Dolor, and then there you can see all the clinics that want to stay there, and then all the clinics that has the car therapy, and then you will have access to all this type of information, okay? Then, now we have it. We finish our webinar, and now I will put the big screen, and you will see us, Carina and me. Carina will come with me, and we will ask the questions you have, okay? Thank you very much.